Hi everybody and welcome to another short clip of palliative education. And today what I'd like to talk about is really quite a complex issue, but one that causes a lot of concern for health practitioners, and that is where the role of nursing homes and residential care facilities come into providing end-of-life care for palliative patients. Now, to say this is something that a lot of clinicians and healthcare providers certainly causes a lot of anxiety for them, but it's really important to understand kind of where residential care fits into palliative care and wider end-of-life care agenda, because it's something which is changing. And it's something that's going to become increasingly important in the future. So, for me as a palliative care physician, what's sort of my interface with nursing home care? Well, the first thing to say is that 20% of my patients who I discharge from our palliative care unit will end up being discharged to some sort of residential care facility. So it's not an uncommon scenario. It's something that we deal with quite regularly. But a lot of healthcare providers that I come across, some of the people that I work with, other doctors, social workers, nurses, have real concerns about, is that the right thing that we should be doing? Is it appropriate for patients who've perhaps got a life-limiting illness to be going into residential care? And some of those concerns are perfectly legitimate. It takes a lot of time to get someone into a residential care facility. It costs money for that patient or their family. So they're very valid concerns. But equally, we need to understand the changing demographic of our population and actually the population of patients that nursing homes are looking after. So let's have a little look at a graph. And what I'm going to do is we're just going to have a look at length of stay plotted against time. So if we put time on the x-axis and measured in months, and then this is sort of frequency of patients. And what we see is, if you look at admissions to nursing homes and their separations, you don't get an evenly distributed curve. It's very skewed. So it'll look like this. Now, what's really important here is the time frames, because the median length of stay in a nursing home in Australia at this moment in time is actually 3 months. And that's median. So half the patients who enter a residential care facility are only going to be there for a very short period of time. Now, within that population that are there for a short period of time, 10% will only be there for 4 weeks. So a lot of people hear that statistic and their reaction is, what's going wrong in nursing homes? Is there an issue that means that if you go into a nursing home, there's something wrong with the care that you're receiving that means that your life expectancy is very short? And actually, it's got nothing to do with that, and it shouldn't really, these statistics shouldn't really surprise us at all. And if we take a look at why do patients need to go into a nursing home? Well, generally patients need nursing home care when they're no longer able to look after their their families unable to look after their care needs. Their dependency is getting greater. Now, usually in terms of what that looks like, that means that perhaps patients aren't able to mobilise themselves. They're needing assistance with mobilising. They might be becoming cognitively impaired. So there's been mental decline. That means they're just not very good at planning what they need to do. It might be that they're just needing basic care with feeding and hygiene needs. Now, if we look at that sort of problem and how that comes about, the majority of patients who are getting frailer and becoming more dependent because of those issues tend to arise about 3 or 4 months before a patient dies. It's part of that transition period between a patient being relatively well and able to maintain their independence and transitioning to a point where they're entering the dying phase. And that 3 or 4 month period that we see before a patient dies is typically where they're becoming more dependent and they need nursing care. So actually, this graph shouldn't be a surprise at all. If we've got patients that we're discharging from hospital that aren't in the imminently dying phase, but they're getting progressively more dependent, our expectation is going to be that they're probably only going to be in residential care for a few months. Now, this obviously needs a bit of a shift in our mindset, because really what I'm saying is residential care facilities are going to become the new hospices. They're going to be serving a population of patients who are potentially deteriorating quicker than they used to. So, what can we do to support our patients and make this transition through to residential care a bit easier? Well, the first thing is that we need to be discussing these issues much earlier in a patient's illness. And obviously in recent years there's been a move towards better advanced care planning. But a lot of the focus on that advanced care planning has been about preparing for the dying phase. So we ask patients questions about where do you want to die, what treatments do you want or do you not want if you're approaching the dying phase, do you want to be resuscitated, those sorts of questions. Whereas actually one of the most complex issues that we need to be introducing into our advanced care discussions is getting patients to think about and prepare for the situation that will arise when they're getting more frail but they're not yet dying. In this sort of 3 to 4 months where they need to be prepared that they might need to go into care. Because if we prepare patients for this and we prepare families for it, it's not so much of a shock, it doesn't come as a surprise, and it makes it an awful lot easier to transition patients into care facilities. Now, the other thing that we've got to be mindful of is that if we know that patients are going to be transitioning to these facilities and they're not going to be there potentially for a very long time, these are patients that are not potentially going to have very long to get used to the staff that are there. They might not have much time to actually get integrated into primary care services. So it's really important that when we're transitioning patients to care facilities, that we've kind of got as much prepared for the nurses as possible in terms of their care planning, making sure that when they go into these facilities, there's provision for things like parenteral medication if they need it. So what I would like to really sort of encourage with you is perhaps an altered view of what goes on in nursing homes, the sorts of patients that they're looking after, and kind of an understanding that increasingly we're going to be seeing patients who have to transition into residential care that are going to be short-term patients, and that's perfectly valid. It's going to become an increasing workload for residential care to have to deal with, and it's going to become an increasing normality for us. So rather than us getting too worried and trying to think, you know, is a patient's life expectancy too short that it's worthwhile transitioning into residential care, actually we should be seeing that this is a normal thing to do, something that we're going to have to do with some frequency. And if we've got an understanding that it's okay to do this, and we can communicate that to our patients and our families, then it helps everyone all round. Okay, well I hope you enjoyed that short video, and I'll look forward to seeing you for another short clip of palliative education in the future.